Hello, and welcome to Skills to Pay the Bills. In today's segment of JustAskFreeman.com, I'm your host, Freeman Owen Jr., and also with me is my co-host, Ms. Tia Young. Tell me, Tia, what's on the menu today?
Well, Freeman, first of all, thank you so much for having me sit on the other side for a change.
All right,
This is
welcome.
going to be fun.
Yes, it is.
Thank you. And we do have questions today. The first thing that I wanted to talk to you about, a lot of people felt that once they retired, they'd be on easy street and expenses would be lower. And many folks are finding out that their expenses are much greater in retirement than when they were working.
Exactly.
Can you talk about that?
I surely can, especially middle income families, or I should say both men and women, in income ranges between $25,000 to $75,000. Well, once you come out of, once you leave your job, they found out and surprised that healthcare cost was significantly higher than when they were working. So as a matter of fact, about 55% of their income is geared toward healthcare. Something else too.
55% Freeman?
Exactly.
Wow, that's a lot.
A lot. And when it comes to groceries, that Safeway, that Giant, Food Lion, that cost has increased about 44%. So healthcare increases, food, gasoline, but the most significant increase in expenditures once one has retired has been healthcare.
Wow.
That's a big issue.
Well, let me ask you this. I'm thinking that many people, by the time they're 65, I think that's the age where you can start getting Medicare.
Exactly.
So you've got Medicare Advantage, you've got Medicare supplemental plans.
Exactly.
I thought those would help to defray costs. Do they not work as well as you would think?
Here's what happens with Medicare. Now, Medicare absorbs some of the cost. Now, I think you're thinking about skilled care as well, which is a significant increase, or referred to as long-term care.
Okay.
In our retirement income planning, we use not only emphasize the fact that you're going to need an emergency fund. I'm going to talk about that a little later. You're going to also need to coordinate your resources with Social Security if you are eligible. And most importantly, you have to understand that as we age, and if you're 65 and married, well, there's a 50% chance that you will need skilled care. That is, skilled care I refer to as I mentioned, long-term care, whereas if you cannot perform at least a minimum of 2 of the 5 activities of daily living, then you should have skilled care. Now, something that's interesting about skilled care, I've heard folks say, well, Mr. Owen, it's too expensive.
Yeah.
Well, now there are products. Here's another thing. I have health issues, so I wouldn't qualify for health care. Or another excuse, I may never use it. Well, you might have to use it. But now there are products on the market such that there's annuities and life insurance that have skilled care or long-term care benefits attached. So that eliminates any excuses. And you don't necessarily have to have you don't have to be in impeccable health.
Oh, okay.
That's right.
That's good.
Exactly. So there are benefit packages that are associated with annuities. You can have a skilled care benefit along with the annuity, and even an enhanced death benefit as well.
Right. So Freeman, it sounds to me like you're saying as hard as we might try, regular savings, retirement income, and Social Security is just not enough.
No.
It's just not enough.
If you're betting on Social Security and a pension, well, we can't necessarily depend on that. We need our own resources. We've seen over the years now that many pension programs have been eliminated. And there are millions of people out there, especially the boomers, born between 1946 and 64. They have no pensions at all. And some of them were not prompted to contribute to employer-sponsored retirement accounts during their working years. So they get out here and they don't have enough money. And they may be dependent upon only Social Security.
Right.
But it's always good to I emphasize that you always save money. And there's an important point I'm going to make about that comment later on in our segment.
Okay.
Mm-hmm.
All right. That's really good. And this long-term care
Mm-hmm.
is something that I think people really need to think about.
Really think about it and really acquire it.
Right.
Because there are, as I mentioned at the outset of this conversation here, there are products, safe insurance products, such that you can have skilled care, minimize your costs, and also get insured. That is, you protect yourself against depleting all your assets and
Right.
resources.
Right.
What's
Right.
the average cost? $7,000, $8,000 a month. And something else to you, the average stay is 2.5 years in a nursing home.
Wow.
So think about that, about $150,000 bill there. And it could deplete your assets if you don't have long-term care policy,
Right.
or if you don't have that rider attached to some type of resource that provides that service for you.
Well, another question we have, and this kind of gets into, you were talking about pension and Social Security benefits, and there are some individuals who have said that when they retired, they thought that they would collect their full retirement from past employment and their full Social Security, but when they applied, somehow that's not what happened.
No.
Some of the money, they didn't get the full amount.
Exactly.
And they never understood what was happening. And one woman said something about they were trying to explain to her something called windfall elimination or WEP.
Yeah, it's called WEP.
Can you address that a little bit?
Elaborate on that a little bit. Well, there are a number of employees that don't pay into Social Security. So WEP was enacted back in 1983, such that Congress felt, well, it's not fair for an individual to sort of like double dip, I'll use that vernacular, where an individual doesn't pay into Social Security at their current employment, and they might have qualified, had enough quarters to get Social Security outside such as the private or public sector. So therefore, some of the Social Security benefits are cut or reduced. A good example is, let's take the federal system. You've got basically 3 classifications there. You've got SERS, civil service,
Right.
SERS offset, and then you have FERS.
Right.
About 84 to about 1987, this WEP was introduced. Some individuals had to convert from civil service to FERS, or Federal Employee Retirement,
Right.
that status, or SERS offset. Now what happens at age 62? Let's say this individual has retired at age 60.
Right.
Well, they will get their full employment, I should say their full pension, until age 62. And then there's a reduction in the Social Security benefit if they qualify, because the FERS and SERS offset employees pay into Social Security. Civil service status individuals, they don't have to pay into civil service. But what if they worked in the private sector
Yeah.
and they were eligible?
Yeah. So what
Again,
happens there?
at age 62, there would be an offset by Social Security that is reducing the benefits. If we look back in, let me see, I had made a note here. In 2004, the average reduction was $306. And 9 years later, that reduction is $100 more, $395.50 reduction on that Social Security benefit. So again, that's how you have to plan very well in the event that you have, you're working in the private sector and you're not paying in Social Security, or if you work in the public sector, but you have the quarters and you're eligible for Social Security, you can expect a reduction in that Social Security benefit.
Wow, that's really something.
And something else too, it could also impact the survivor benefits of the spouse.
Oh no.
So you can get
In a negative way?
in a negative way, yes.
How? How so?
Well, the Social Security Administration could reduce the spouse or the survivor benefits by as much as 2/3 of the amount of a government pension. And I've got some great strategies to help individuals obtain survivor benefits without hurting them too much when it comes to their retirement distribution or their monies that they're receiving on a monthly or annual basis, or however they receive those resources.
Well, Freeman, could this be, based on what you have just said about pensions and retirements,
Right.
and could this be the reason why so many people above the age of 65 are continuing to work?
Oh yeah.
I can remember back years ago, I mean, folks started looking forward to retirement when they got about 55. I mean, they knew
Exactly,
they only
they
had,
knew.
was winding down, but now you go into the workforce, especially federal government, and people they're not retiring.
No, they're not.
So that means that the young folks who have gone and got all these MBAs and all this education,
Exactly.
you know.
Well, look at the cost of goods and services.
Yeah.
Before the Great Recession, the average age was what? Person said, oh, I'm getting out of here at 57.
Yeah.
All right, now it has been pushed back to your 60s. Now, 80% of all the people in the workforce today, they're looking at, well, I'm going to retire, but I'm going to get some compensation. I'm going to work either part-time, where I receive some type of funds. And inflation, increased health costs have prompted or fostered the move to defer retirement for a while and then come out later. And you have to, as I always say, you really can't do this all by yourself. A lot of folks make a lot of mistakes. They retire too soon. They have a tremendous amount of debt. They have no resources, in which they are forced to retire. I mean, forced to work, beyond 65. Some working at age 70, 75.
And 80. I mean,
and 80.
I work with some people who just retired and they're right at 80.
Exactly. Yeah. So, with like I said, inflation has, and that Great Recession has really put a dent in the dreams of individuals who wish to retire before age 60. And in a lot of cases, before age 65.
Wow. That's something.
It is something. So that's, we've got solutions for that. Now, folks, we're going to take a short station break, and we'll be right back after these announcements. So I want you to stay right with us on Skills to Pay the Bills and on this segment of JustAskFreeman.com. Stay with us.
Hello? Patty, I've decided to follow your lead and file for Social Security benefits online.
But Kath, aren't you back in Zanzibar?
I just got on my laptop and went to socialsecurity.gov. It took less than 15 minutes.
Wow, you are a miracle worker.
Well, cheers, Patty. I'm off to film a baby rhino.
Baby rhino?
Well, welcome back to Skills to Pay the Bills, and I'm your host, along with my co-host, Tia Young, and we are having a discussion about, well, I want to welcome you, Just Ask Freeman, but we're talking about the expenses of retiring. We're talking about, we're going to talk about affordable health care, a little bit on that today.
That's right.
And how the government shutdown impacts.
Oh yeah. I try if I can to stay out of politics as much as I can, but
Same here.
it's just kind of hard. It's hard not to talk about the government shutdown just a little bit.
Okay.
And I have a question. People have just come back from work after being almost 3 weeks.
Exactly.
In a shutdown situation, and a lot of people went through their savings. Some people have maybe about a month of savings to carry them through, and folks got to the point where they were afraid that they weren't going to be able to pay their mortgages, or they weren't going to be able to meet all the household expenses. So
Exactly, yeah.
I'm being told that a lot of folks went into their 401ks and into their annuities. I know that if you are a certain age, you can tap into 10% without penalty. But a lot of these people were not at that, over 50,
Right.
and they had to go into their annuities. So what do you say about, that?
Well,
Do
here's
you have to do what you have to do when you have to do it, or?
here's what I say about that. Not one of our clients had to access monies from their annuities.
Really?
Not one. I always say this because we planned early in the retirement income planning sessions. Well, I always advocate that you have anywhere between 6 months to a year's income to offset your bills or to pay your bills. And I'm talking about the bare minimums, the mortgage, your utilities, food, and not extravagance, just the basics. If you can't make a year, 6 months. Can't make 6, at least 90 days. Now, number one, I'm a big proponent of not using your annuity as an ATM machine.
Yeah.
I've said that over and over again.
You have.
But here's what happened when individuals make the mistake of acquiring money or getting a distribution from their employer-sponsored retirement account or their IRA, especially if they borrow money from work, from their 401k or their TSP or 403b. Well, what can happen is you can really only access this money maybe one of 4 or 5 different ways: hardship, education, borrow money. But what happens if you borrow the money, separate from service, and don't pay it back? Then you're sacked with a nice liability from IRS, that 1099 to come in there.
Because that's income. They look at that as
That
income.
is ordinary income, is
ordinary
taxed as
income.
such. If you're under 59 and a half, if you take a distribution from your employer-sponsored retirement account, well, let's say you need $20,000. Well, 20% is going to be deducted immediately from that $20,000. All right, and if you're under 59 and a half, there's another 10%. So if you're getting $20,000, $6,000 is taken out of that money, alrighty, and you receive the check for $14,000. So it is not a good idea to take money from your 401k or your TSP or any of your employer-sponsored retirement accounts.
Wow.
So and I put a lot of emphasis on it. When we do our reviews, make sure that you have adequate funds, because a lot of people did get hurt and they had a tremendous amount of debt. And so all they could do is turn to the monies they had available in those employer-sponsored retirement accounts.
Right, that's right.
And that means you couldn't go 2 to 3 weeks without having some type of financial instability and not being able to pay your bills.
Right.
And we've got some folks, we've seen them, the high income earners. The problem is they don't save, they spend, and they have a tremendous amount of debt.
Right. So, Freeman, it sounds like, let's just say someone inherited $50,000. And if you're that person, and you don't have that much in savings, it would be better to maybe get an annuity for $30,000 and put that $20,000 in a place where you can get to it if you can, rather than put the whole 50.
Yeah.
And then in 1 year
Exactly.
or less, you're having to go in and get it.
Well, here's what I would do if someone inherited $50,000 and they don't have an emergency fund. So I would look at them, and I always use the word suitability. Okay, they would not be suitable for a long-term contract if they have no funds to protect themselves for what we've
Disaster,
seen,
yeah.
this
Emergency.
government,
Right.
this government's
That was
shutdown.
unforeseen.
So that individual might not be suitable. Now, if they inherited money and they have an emergency fund and they have other adequate resources to tap into, then we might provide the annuity for them, or the life insurance, and most importantly, it would be a strategy to provide these safe money products for the clients and not just sell them, and to use these products to provide a guaranteed lifetime income. Liquidity options are there, and then you could pass on some of that inheritance money, if you are suitable for the annuity, to your loved ones.
Right.
Exactly. Yep.
Okay.
So,
So it is not a good, the point is that
it's
it is
not a
not
good
idea
idea
to go into your
retirement
accounts
No.
on that end. Wow.
Whether or not it's at work or if you set up your IRA, but there are some means in which you can acquire this money.
Well, Freeman, another issue that is just, like I said, I try to stay away from political stuff, but
Right.
it's just all around you, it's everywhere.
Exactly.
And this affordable health care, to me, should not be a political issue, but it is. What can you share with us about the Affordable Health Care Act? Because so many people are confused about it. They don't know whether it's good, they don't know whether it's bad, they don't know whether it's in between, if it will really help or if not. Businesses have gone nuts
Exactly.
trying to figure.
Yeah.
What can you share with us?
Well, I've examined the Affordable Care Act, and it was enacted back in 2010. One of the provisions was that allowed young adults up to age 26 to remain on the parents' health coverage or health insurance. But starting this year, there has been there's increases for high income earners. It's sort of associated a little bit with Medicare. You can expect in 2013 an increase in the cost of Medicare, the Part B aspect of it. You can also look forward to in 2014 that everyone in the United States could have universal health care. Now, you can get more information on the website justaskfreeman.com, and where I have a life guide which outlines the 5 core provisions of the affordable health care.
Oh, okay.
I've seen that some folks in various media, they say, well, I don't want Obamacare, I want affordable care.
They don't realize
They
this
don't
is
realize
one
it's
of
the
the
same
same, yeah.
already.
Yeah.
So you can go to justaskfreeman.com and then download the guide that I have there, and I list all the provisions. We can also look forward to the fact that next year, the employers with 50 or more people, the big companies, they're not obligated to provide health insurance.
Oh,
Okay.
Okay.
But they may be subject to what we call, let me refer to it. Shared responsibility payments.
and what is that?
Okay, this is where they are fined a certain amount of mandated, a certain amount of money if they don't provide the coverage or they don't meet the or satisfy the individual mandate. But many of the big companies can do that if they offer health coverage. So, the affordable health care too is a good thing because what it does, it provides health coverage for millions of people with pre-existing conditions. So the insurance companies will not have to increase premiums. And also, like I said, the pre-existing conditions did not shut out an individual from having the health coverage because prior to the Affordable Care Act, you had, and we paid for it as taxpayers, many individuals would have to end up going to an emergency room. That was their primary provider. Okay, so this offers solace. Employees of small companies, that is fewer with 50 employees, is not required to provide health coverage either, but they will have an opportunity to get credits if they provide the health care for their employees.
It's like tax credits.
Yes, they will get the
credits, okay.
federal tax credits to help with the cost of providing health insurance. Now, the higher income individuals, beginning this year, as I mentioned, additional Medicare taxes are paid by higher income folks on their wages, and for the first time on net investment income. Now, again, you can acquire the guide on affordable health care I got available there that would tell you the different levels of income or net investment income and where you will be assigned or assessed a mandate type of fee
Okay.
if you don't offer
If you
health
don't offer
insurance.
it. Okay.
Exactly.
Okay.
Medicare, speaking of Medicare, it has added free preventive services and Medicare Part D, which is the prescription drug,
right,
okay?
right.
Coverage gap, well, that's going to slowly close by 2020. And so Medicare currently covers about 38 million people. And as a result, we can see the Medicare pilot programs too that will be implemented. So you're going to have a lot of free screenings. Even myself, I'm going to get my flu shot. And
Yeah, I got to get mine.
that's
too.
right. I'm going to run on over there to my physician, take care of that. So if you want more information about the Affordable Care Act, like I said, you can go to my website, justaskfreeman.com,
Good.
and download that healthcare provision there for you.
Well, Freeman, I have one more thing that I wanted to ask you. In December of 2012, the Wall Street Journal predicted that women would take the lead in retirement planning. Is this still on track? I mean,
It still is.
2013 now, so can you talk a little bit?
Well, I got a few seconds left.
Okay.
Women have taken the lead in professions such as the medical field and law. 33% of women are physicians. And another 32% are attorneys. And something I want to add too, I said this on a show several months ago. Ladies have big 401ks and TSPs and they save a lot of money. So I want to close with that. Well, folks, we're out of time, and I hope that we hope that you have enjoyed Skills to Pay the Bills and today's segment of JustAskFreeman.com. So I'd like to leave you with these thoughts. As like I always say when I finish a show, keep your money safe.